Folks, welcome back to another episode of the NYU GPH podcast. And as in every episode, GPH is fascinating. People come from all kinds of backgrounds. Today, our background is someone that has come from traveling the world, studying neuroscience and even Spanish, and now is influencing and pioneering in her own public health journey going forward. We have Natalia De La Viña. Natalia is an MPH candidate here at NYU GPH, specializing in global health. Her professional journey includes extensive laboratory experience in cardiology and public health, as well as providing bilingual medical services and health education to transborder populations in northern Mexico. Currently, she co-leads the Applied Global Public Health Initiative Lab, which is AGPHI. A lot of you students have probably heard of that, and overseeing 7 projects in critical areas such as maternal and neonatal health, environmental health, and disease surveillance, and even prevention programs. I can keep going probably at this time. She's completing her applied practicum also in Peru at this time, and there's a lot going on when it comes to that. Her ultimate career goal, because I spoke to her before the podcast, is she's pursuing an MD. She's studying for the MCAT right now as this interview is being shot. And she wants to establish a surgical rotation clinic and devote human resources and medical supplies to local clinics in Latin America, aiming to provide medical care across multiple continents for low-resourced communities. Finally, Natalia is also a yoga instructor and loves everything health. I feel like I've been meditating in the past few minutes talking to her before we start recording. But Natalia, welcome to the IMGPH podcast.
Thank you for having me, Aman.
You know, the first question, I have so many questions for you, and there's extensive things we could talk about. The word diabetes comes to my mind. I didn't mention anything about diabetes in the intro, but when I say that word, why does it have such a profound impact in your life, in your public health journey?
Oh, definitely. I never gave thought to diabetes before my undergraduate career. I always just knew that, when you're a kid, you have some other students amongst the cohort that may have diabetes, but you never give thought to what it means when someone that's at an older, more adult age has diabetes. And then when I entered undergraduate and worked with unhoused populations in downtown Tucson, to then becoming the medical interpreter, every single patient that we saw had uncontrolled diabetes, essentially. If not, they were diagnosed with pre-diabetes. And that is something that has definitely impacted and left a lasting impact on what I consider diabetes now. Because it's no longer just, a diagnosis or something that someone has. It's something that demonstrates perhaps in a specific setting, where is that person? What are their lifestyle factors that are impacting that? What resources do they not have in this very moment that could help with the treatment? And most importantly, I found out in my MPH it's a non-communicable disease. And the non-communicable disease, it's a chronic condition.
What does that mean?
Oh, yes. So there's non-communicable diseases and a communicable disease. So the communicable diseases are going to be those that are infectious, whereas non-communicable means that they're not contagious, essentially. So diabetes, hypertension, some poor heart outcomes like stroke, heart ischemia, any of those things, those are going to be non-communicable diseases.
So that was your introduction to the world of diabetes at the time, and you started noticing all kinds of things in the world?
Oh, yes. Especially in this specific clinic I worked in at U of A. Mm-hmm. There was a Clínica Amistad, which I got into because of my Spanish major. I took a class at the College of Medicine in Tucson to learn how to be a medical interpreter for different populations that were Spanish-speaking, and most specifically transborder populations. So when I began my work at the clinic, every single time we saw a diabetes patient, my providers would always point it out, and they would almost walk me through the treatment, how you diagnose it, and different lifestyle factors that go into it. And actually from there, I was proposed to be, and did become, a pre-diabetes educator. So they offered to pay for my certification and wanted me to be the first cohort to try it out in their clinic. And from there, that's where it kind of just spiraled off. I loved it from there. So, yeah.
What came inside your soul that you're like, I want to study Spanish at that time? That was this the passion that these the transborder issues are something that I'm close to. Where did that itch come from for you?
Yeah, that's a great question because for me it was a turning point and it really changed the different opportunities that came to my life. So I'm bilingual. Both my parents are from Bolivia and I've grown up going back there every single year since I was 8 months old. And for me, it was like I took this exam and I could finish my Spanish minor in one semester. And I was like, great, like I could just do that so easily. And it was that moment in that first semester when I took that class where I noticed, I was like, this is such a big part of me. I don't want to lose it because it's not just losing the language, but it's losing the culture and the community. And that's when I decided to go into my Spanish major. And it was definitely difficult because I double majored, double minored, but I absolutely loved it. And it definitely played a pivotal role in what my career ended up becoming.
Speaking of the double major, double minor, we didn't hear any of them.
Oh.
What was the other major? Because we mentioned neuroscience, and I know that it's neuroscience, but what are the other things that collaborated with this before? Were you neuroscience first, Spanish first? How did that identity build for you?
I was really lucky because I went into college thinking I'll just be biology. I loved biology any single time I took a class. I still do. And then I was in biology, but I realized I talked to this one student who's a friend of mine in a chem class, and she was looking at all of her electives for neuroscience. And I thought those are the classes that I want to take. It's about learning different like mechanisms, whether it's like signaling or you're learning about, neurochemistry and all of that. It's so interesting, and I'm really glad I switched it early on. We were a very small cohort. I think the year before me was 70. I think they only started a few years before. But I studied neurobiology specifically, Spanish literature, and then I became an emergency medical sciences minor and a biochemistry minor. So biochemistry was easy with neuroscience. I only had to take 2 extra classes as I was a pre-med track. However, the emergency medical sciences, I had this profound love for emergency medicine for a long time. And I wouldn't say it's quite emergency medicine. I would say it's more of like primary care in the sense of I was a lifeguard for 5 years.
Whoa.
Yes, I was a lifeguard and then a lead guard. And I have just been learning CPR and doing practice trainings for so long. And I just knew that that was also something that I loved, that I knew that I wanted to be able to fertilize. And so then when I took my EMT class, which was in the midst of COVID, it was actually a really special experience because we got to work alongside so many other students. We had so many incredible teachers come in and we all took the NREMT and the state exam. And it was a really great experience. And yeah, so that was something that also accidentally happened. But I always remind myself, even though everyone asks me, it's so many things, or why do you want to do this, or the path is so long. And I know that if anyone was in my shoes that didn't have the opportunity, that wanted it, would do it, that nothing can really stop you, that you have to go for what you want and enjoy, what you can get out of any situation. And so I was like, I'm going to work hard. I'm going to do it in 4 years. And I did it. So.
And this is all in Arizona?
This was all in Arizona.
That's so delightful to hear that it seems like paths were opening up in front of you as doors were opening up and you had to make a decision to walk in or not. And it's based on all the hard work. I can't even finish the amount of things you have done. I thought I knew it all, and life came up right now. So I'm curious to know, after you finished all of that and after you were done, you graduated from U of A, where did your path take you for the few years after that?
Oh, yes, right after U of A.
Mm-hmm.
So once I graduated, I already had my diabetes educator certification still for another year. And I had actually done my thesis on accident as well because I love doing the one-on-one appointments with the different patients that we had. I really grew a close relationship with some of them. There was one of my patients who's from Oaxaca, and him and his wife were so kind, and I learned so much about them culturally and just there's a lot of barriers that when you talk to them personally and you understand, you realize that it's so much more difficult than you think to just tell someone to do something. Maybe they don't have the cell phone. Maybe they don't have a safe neighborhood to start walking around in. Maybe they don't even have transport to reach the clinic. Definitely perhaps not enough money to even have any of the medical supplies that are needed to control diabetes. And yeah, just also, I would not say I wouldn't say lack of nutrition education, but I would say definitely like there's just not a lot of opportunities for them to access that. There's a huge lack of access and accessibility for those types of, healthcare education. And yeah, was getting close with it. I felt really intimate with my patients, and I decided to do my thesis. And what I did was I took in about 50 patients, and I did an interview with them and essentially asked them a pre-test of what they thought diabetes was. Did they know what it meant? And if so, what it was? How do they know to treat it? And what does insulin do? And then also was asking about what type of preventative measures do they think that they either already incorporate or do they think is part of their treatment for diabetes. And I wanted to compare that. And then after I did just like some videos and some pamphlets, just explaining to them one-on-one what is diabetes 1, 2, and gestational diabetes. And then also informational videos on how insulin works in battling diabetes. And lastly, then the different types of resources needed to help with maintenance of diabetes as it is a chronic condition. And then I did a post-test and asked them what they found was helpful. And incredibly enough, I thought it was going to be insulin. Like they probably don't know, but they truly just didn't quite understand what diabetes was. And that's what my thesis ended up being. And so I was offered earlier that year to become a medical interpreter for Mexona, where we cross the border, northern Mexico, and we do different clinics there with the community centers and treat uninsured or underinsured patients in Sonora, Mexico, whether it's Sonoita, Puerto Peñasco. And I got really close with a physician there. Her name's Rimka Brakama. She's incredible. And she started asking me once I graduated, do you want to come with me to a migrant shelter and volunteer before we do the clinics? And so I went with her. I was her medical interpreter and for a pediatrician. And we went to the migrant shelter ahead of time. Then we would go to the clinic the next day. And yeah, that's kind of how it all started out. And then after time, they asked me to be, the diabetes not per se educator, but to go in and talk with patients and ask them about how they're monitoring it so that we can have that information in their chart as well. And it was an incredible experience. I definitely felt like underprepared at the beginning and almost shocked that the opportunity had presented itself, but all of the physicians and the head of the clinic just really loved that they could have someone to really ask the patients and want to sit down and really dive into the different things that are going on in their lifestyle that's impacting their treatment. And from there, I fell in love. And I was like, do I love public health or medicine? Because now I couldn't tell anymore.
Did you know what public health was at that time? Did you have like a term for it? Public health. I know that this is public health.
Ironically, I have a best friend from my hometown who majored in public health, and at the clinic there was a woman who did her MD in Mexico and was getting her MPH at U of A, and I thought I knew what public health was. Definitely not. Definitely did not realize that until I went to the clinic. And that's when I realized this is community health. This is, there's a difference with community health, global health, social and behavioral sciences, epidemiology. I think I always thought public health was more epidemiology. And that's why everyone's always geared towards that, right? You always hear specialty medicine. Everyone wants to know the data on the most infectious diseases. And I was never that person per se. So once I realized what community health was, I was like, wait, I do have a huge love for public health. And it asked me what career path I wanted to take moving forward.
And that's how you came to NYU?
Yeah, that's how I ended up coming to NYU. I, at the time, was a hand surgeon's medical intern. So I was
Where did that come from, the hand surgeon's medical? So you were first doing the transborder stuff that you're talking about, and then you had a path like, I'm going to decide public health. Were there other things in the middle that influenced your direction into public health?
Oh, yes. The reason why I was going to apply for med school because I was already working with their administration team, with their registration team, with just a lot of different people that are in the medical school. And there was something holding me back. And at the time, I didn't know what it was. And it really got into my head. I was thinking, why can't I just go ahead and do it. But now I realized it was because public health was in the way. Even I became a medical intern for a hand surgeon, and I learned a lot as well. But in that sense, workers' compensation. I was a medical interpreter. I was, helping sterilize the room, helping with ultrasounds, some splints, casting, everything. And it was incredible because I actually got a lot of one-on-one time there as well, where the patient would talk to me because of paperwork. I'd have to ask them questions, especially with workers' compensation. That's when I realized it's not just transborder populations, it's any underserved population that I really want to help. And workers' compensation is a really deep. Do you know what workers' compensation is?
Explain it for those that don't know.
Workers' compensation, for example, is when someone comes into the clinic and while they were on the job, they got hurt. So, for example, maybe they cut their finger off or there's some tendon or vein damage. And so they would have to come in for an emergency surgery. So workers' compensation is when we work with the employee's insurance. And although it does help cover most things, in the long term, if there is not a successful path towards treatment, then it can end up being a lifelong quote unquote disability. And it affects them because they can no longer work in the profession that they once used to. Maybe that was the only profession they were qualified for. So you see patients coming in and how crippling it can be for some patients on their lives, whether it's they can no longer afford to help with their family towards income or their dignity, being able to do something that you love, you lose that light in you. And so workers' compensation really shaped how I viewed medicine. It's more than just, I always knew that it was more than just treatment, but in that moment I was like, this is truly, even the smallest thing can really impact someone's self-image, self-worth, self-identity. And yeah, so I was doing that while I was doing the Mexico clinics, and I actually ended up realizing that I wanted to do my MPH then. And after I applied to NYU and I got in, I decided to quit my job and start looking for positions here in New York. And yeah, it was a difficult decision, but I knew NYU was the choice for me.
What made you feel that NYU was a choice of you? It seems like your entire life has been in the same place, right? For this long time. You're going around, but you go back to the same base. So for someone like you switching the base like that for the first time, coming to somewhere where the weather is also unusual compared to where you come from, what made you make that decision?
I do love that question too, because at the time, I probably would have answered, I have no idea. But now I can say that I fell in love with public health. I knew I wanted to go somewhere with a great program. And NYU, of course, has a great program, but what made it stand out? And to me, what made it stand out was not only the labs and the different experiences that students have here, but also the sense of community. I knew no matter where I ended up that I wanted to go into working with more Latin and Hispanic populations, but in different cultural contexts. I've worked a lot with migrants, whether they're from Guatemala, Honduras, and a lot of Mexican patients. However, I wanted to learn more about Central American, South American patients and see maybe the different types of intersectionalities that they may have. And so NYU in New York seemed phenomenal, but it was ultimately the Applied Global Health Initiative that drove me there. I read online about the lab and...
So Applied Global Health Initiative is the AGPHI?
Yes.
Okay, tell us more.
I love AGPHI. It was, when I first looked at it, they had so many different research programs or laboratories going on at the time. But I fell in love with two at the time, and that was, there was a telehealth for patients in India, in rural parts of India. And then another one was the Born Foundation, which was working with Latin mothers and maternal and child health. And so I emailed them, and actually Dr. Dickey, right when I wasn't even accepted yet, I emailed him after I went to like this NYU meet your, professors kind of thing. I forgot the title of it. And he was just like, if you're interested, here's my email. And I emailed him immediately and just told him, I'm not even in yet, but I would love to just maybe even be a summer research intern, even if I don't get into NYU. And it was incredible because when I did get in and finally got my acceptance, he led me to Corinne Joseph Tendo, who I was talking to you about before. She was the co-director at the time, and she became such a close mentor to me. She was a team lead at the same time for this mycetoma project. And mycetoma is a neglected tropical disease. It was actually just named one by the WHO in the beginning of 2024. So this project, although over 10 years old, has been working on mycetoma. Only now by the WHO has it been just recognized. And so I thought that was beautiful. But she took on me and this other colleague of mine, Oyen Consola Babayode, who's also incredible hard worker. And we worked on some brochures for patients that were going to go through their intervention. And from there, it was just like, sparks flew. I loved it. There's so many different projects for students to get involved in, whether it's maternal health, whether it's with a Latin community. Now they have like a Lebanese project. And also in terms of, gaining certain skills. They're doing, social like interviews in terms of trying to find the intersectionality between climate change and adolescent sexual reproductive health in Latin and Central America. And also like biostatistics, coding. There are people that, maybe like me, I do not have the best Excel work ethic. I know that's like not branding myself well, but there's some people who are just great with all these formulas in Excel, and you learn so much because they do bring in the people who can teach you that and prepare you well for what it's like to work in a team underneath someone who is just giving you not only the space to, finish your deliverables, but the space to also come up with your own ideas and where do you want to help take the project forward. So it's a really beautiful space, especially for first years, because you grow into that community and you really identify not with the project, but with the purpose of the project. What is driving it? What is the mission for that? And that's how I realized, especially through Dr. Dickey, that it's never about just doing the work and saying it's for this. It's about finding the mission behind it. What is your overall objective and what are you exactly going to get out of it, or someone else is exactly going to get out of it? Because if you don't know how to answer that concisely, then you might end up going in circles. So, but yeah.
AGPHI had such a big influence on you coming to NYU. How would you describe it to someone that doesn't know what AGPHI is?
Even though it's been 2 years, it feels so hard to think back because so much has happened since then. AGPHI is a research lab that's student-led initiative. So we do have 2 faculty that are in charge of kind of overseeing it through the executive board. But outside of the executive board, there's team leads and then research assistants. So the graduate research assistants are incredible. You can meet online or in person once a week with the entire lab, but you do meet on your own within your own project. So we do, at the time, I think we have 8 projects. I don't know if that has expanded to more now, but there's a lot of work that goes into it. And so you meet weekly separately on your own with your team, whatever deliverables your team lead gives you, so that you have tasks to finish towards a greater goal. And then you meet also weekly with the entire lab so that you can help, show your ideas. If you're stuck in a rut, maybe someone from another project has, jumped that hurdle before and they can give you insights. They also give you really great resources. And for first years, a great sense of community. I met some of my really good friends in there and stayed close to them because we got to see each other outside of the classroom. And that is something that was hard, at least for our cohort post-COVID. It was finding time to, meet someone outside, and, it's you forget what interaction is for a minute. And grad school feels so different than college because everyone's working and you're wrapped up a little bit more in your own life. But it was a really great way to still have something academic while still pursuing the same passions with people who have like ideas and values that are aligned with yours. So it felt like a very safe safe space.
Now you come here. This is the AGPHI is one of the biggest motivators, as that's what got you in here. Your conversation with Dr. Dickey as well was a huge one. Before I continue to even find out more about the projects you have done here, I'm intrigued by your neuroscience background. How is that serving you right now, or how did that serve you in the whole process? Because it seems like you're doing translation stuff. People's hands are messing up, and like you're learning about workers' comp and things like that. Where does the neuroscience part of your degree come in? Because that is a tough degree to do and dedicate a lot of time to.
Yeah. I actually genuinely just love neuroscience. Ever since I was a kid, I loved psychology and learning into it. And it's so funny because I always tell people I always wanted to be an astronaut before I wanted to be a doctor, until I realized you're alone up there. And medicine, you help create and build communities. But I've always been just so driven by science. And as I'm studying for my MCAT, it's hilarious because I have missed science so much that I look forward to my studying. And I wish I was exaggerating, but I get so excited, especially when it's like OChem or when it comes to psychology, especially just like some things that it's review, because it just feels like it naturally clicks for me. And so for neuroscience, it's funny because I think that in terms of the master's in public health right here as a global health, it doesn't play as great of a role. However, if you look at like the social behavioral concentration, maybe even community health, it can really help when you're thinking about decision making. And when you come up with different initiatives as to what's going to help the community, neuroscience, in my mind, does play a huge role, because you can't just advertise health sometimes. You need to advertise something that benefits the community or benefits the individual, as well as benefits whoever's trying to, market that. So I think neuroscience overall does play a huge role. But in terms of my MCAT, yeah, it definitely plays a bigger role in the MCAT in terms of
the next phase after you're getting your public health stuff in, and then that's the more specificity of where you're taking it. So it seems like all these majors and minors and experiences are now coming together, and people can think, what more can Natalia do right now? Like, what more? And you have done something more. Is you've been at NYU. You're graduating this semester. We're filming this in around 2025, early 2025. And you have founded a club over here called LINEN. And if I read it right, Latin and Indigenous Native Health Equity Network. Is that the name? A lot of prospective students right now, probably watching this, students that have been here for a while, I have a club idea. I don't know where to start. How did Natalia do it in such a short period of time?
Well, it's funny because actually my first week here, and I wrote about this recently in a personal statement, I tried to found another club, which was the Graduate Public Health Network, because I noticed that I wanted to just help create a community. A lot of people wanted that. But it was such a different approach with LINEN, because even though the process was the same, LINEN was it was a task that everyone knew that we almost needed, but it was going to be difficult and overtaking. And I was so grateful to have the support of, my fellow student ambassadors when I was founding at the time, and of the Office of Student Affairs. When I pitched the idea, which was inspired from some of my other peers that are Latin or Hispanic here, not only were they super supportive, but they loved the idea that I was really trying to cultivate that public health aspect in there rather than just the identity group. And what I realized is that, so my parents are both economists, and wow, I love them. Yes, they're incredible. But my little brother's also going to be an economist. So they know exactly how to help him and what kind of, help he needs, whether it's resources or in terms of talking to professors or, networking for job opportunities. And it's funny because my parents are still trying to convince me to go into business, but I cannot. It goes right over my head. I'm not great at business. And when it came to my journey in pre-med, especially as you could see, just really taking a leap and going through every door that I could, I didn't have as many resources as some of my other peers and colleagues. I just wasn't as informed because I didn't come from a family of physicians or, knowing what materials to come or what necessarily medical school entailed. And I was so lucky to be a part of the Border Latino and Indigenous American Indian Summer Exposure to Research program, at the time called Blazer. And they gave me all of the resources to succeed. They told us about, they actually gave us materials to study for the MCAT completely for free. We were able to work with, you know, a Native American population and head chief in a hospital and discuss different traditions. And essentially all my friends from Blazer, I had gotten really close to, especially with one friend. We ended up doing the medical interpretation together. And I realized in that moment that I wanted that for public health. I had a community and I had a safe space where I was given resources without kind of being looked down of like, oh, how do you not know that already? And I really wanted to cultivate that for the Latin and Hispanic and Indigenous Native population as well. It's something that we often overlook. You know, people, you have a passion and you go for it, but sometimes there's small things that can slip through the cracks. And so I wanted people to have not only the sense of community of being able to know that there's other people, but you know, coming from the same background, but also asking them what are their passions, where did they come from, why are they pursuing this, and finding different resources like, you know, Jose Plasencia, who's an incredible alumni. You know, he has a fellowship right now with NHMA. He's going to come and speak to students about how to pursue, you know, post-career options, how to get into fellowships and big internships. And we also had the CEO of NYC and Health Hospitals come in, Helen. She's absolutely incredible.
We've had her on the Helen Levin there.
Yes.
Yes. We'll even link her in the description. You can check out that episode.
Yes, she's such a kind soul. And she came and talked to us in a way that was different than everyone that I've ever had in any other organization. Instead of having a presentation, instead of, you know, wanting us to download something beforehand, she just came in, sat in a circle with her students and just talked to them about her journey, her path, why she leads with the community rather than just by herself, and the different decisions and background that it took for her to get where she is. And it was the most inspiring to this day thing that I've ever heard. She's truly a huge inspiration to me. She's definitely a role model. But having cultivate that for students, for them to have the opportunity to talk to, you know, a CEO and learn things one-on-one from them that otherwise they may not have had the connection for, was extremely important. I really started to when I had these two really great friends who I met my first semester. And similarly, because of the post-COVID anxiety, we didn't talk until towards the end of the semester, even though we had so many classes together. And they overheard me speaking Spanish. And that's when they asked me if I was, you know, Hispanic or Latino. And I was like, yes. And we bonded over that. And the one thing that I struggled with was I really wanted an APE so desperately with a Latin community, whether it was here in New York.
What is an APE?
Oh, the applied practicum experience. Yes, which all second years, well, anyone who wants to graduate has to take. And it does vary depending on your concentration if you do a thesis instead. But essentially you find an internship and are able to do some public health work. And, you know, there's core competencies where it's, are you working on, you know, diversity, cultural competence, or are you working on, you know, bettering the community in another way? And so I was really desperate to find an APE that was working with the Latin community, because I promised myself when I come to NYU, to New York, I want to work with those populations. I want to broaden my experience and learn from these other cultures. And my friends kind of got into the same rut that I did, where it was just a lot of these internships weren't actually doing research with, you know, the Hispanic or Latin populations. And I was really lucky where I was in AGPHI and we had a guest speaker come in from CMMB, the Catholic Medical Mission Board. Her name is Marcia. She's incredible. Her and Joelle are the volunteer coordinators, and they mentioned a project in Peru. So even though it almost felt like it fell into my lap, I know that that's not the case for everyone. And I wanted to make sure that those who are seeking opportunities to, whether it's for your career or just, you know, an internship to see if you want to step your foot in it, even if you don't belong, you know, part of that background of being Hispanic or Latino, if you want to work alongside them, or work with them, then you have that opportunity to. So that's what the whole goal of Linen is making sure that students not only feel, you know, a community within themselves, but have those opportunities to engage and with different organizations that can help them, get to where they want to in their career.
You had something for yourself that gave you community that the economist family probably didn't provide at the time, and now you gave it to GPH as it served you. How did you even get started on this process of making a club? What is the process for someone if there's a step by step to start a club? Where should someone start?
Oh, yes, definitely. So definitely email Alicia. She's incredible. She's one of the OSA faculty members. So she's Office of Student Affairs. And she was luckily my old advisor at the time, but she had transitioned to work with another concentration. But she knew me from student ambassadors and everything. Once you connect with her, you can go online and she'll give you the resources on how to, create a petition for you to get 20 signatures and from other students saying that they want this club to be created. You have to write a constitution for the club, different rules, how is e-board going to meet? How are you going to make final decisions in your club? And to be honest, it is kind of more simple, I think, with Linen, because we're not about making decisions. We're about how can we, help our students create a bigger community. And lastly, it's just about finding your executive board members, which, as I mentioned, those two students, I immediately let them know once it was finalized and said, hey, do you want to be my, vice president? And they said yes. They were so eager to join the executive board. And because of them and the help of another friend, Luis, we got up and running because we were so close to not having enough executive board members. But when you have enough people really wanting to support you, you can build anything. So I'm really grateful for them because we want to continue that. And now we have first-year students who want to continue to cultivate that and carry on the club for next year.
After talking to you, you seem like someone that is sociable and is very open to having conversations and communication with people. And that takes a lot. Moving to a city like New York, it feels like everyone is here, but it might actually be quite lonely in the beginning for someone to move here. So how did you find your peace in New York, and how can other students do the same?
Yeah, I love that question, especially because I do consider myself extroverted. But at the time when I moved here, it was really difficult. I did find myself being a bit more isolated and more introverted than I was used to. And you create your own identity here, If you're away from your family for the first time across the country, you get to really explore what that means for you. And I did have a difficult time with the seasons at the beginning because last winter was incredibly crazy. We had 18 days with no sun, and I never knew what life would be like without no sun. So after wishing for it, I got it. But I found a community in Core Power Yoga. So back in Arizona, I have always had some type of fitness community, and it was my cycling community where I had best friends. Just by going to the classes, I became best friends with the instructors. My childhood best friend ended up joining me, and I met another best friend through, mutual friends there. And they're just my core group. They're my people. And leaving that and having to see them still, have that community within themselves. And, here in New York, everyone's go, go, go. If you take a workout class, typically what I found was people don't want to, build a community. They're just there for the workout. They want to achieve some type of physical goal, maybe spiritual, mental goal, and they just leave. But at Core Power, I found that it was a place not only where I could exercise, but where I felt like I could just truly liberate myself from my mind. I could be there in the moment. It was like a gift anytime I went. And yeah, I ended up signing up to be for the certification process a month after that. And I became a teacher. And ever since then, teaching has helped me balance my life in ways that I never imagined, because especially when you focus only on one thing, you can become so stressed out or tense because it's the only thing that you have right then and there. And having something else, a community where, instead of a lot of grad students pursuing public health, you are surrounded by community where there are healthcare, PAs, physical therapists, maybe actors, dancers. So many of my friends are in the creative field, and it's incredible to be surrounded by so many different perspectives in terms of New York. And I've now cultivated really deep friendships from having not only my job there, but that community space. with students as well. So yeah, that's how I found my home in New York. And I recommend to anyone who comes here to New York that you need to find what you love, find your passion, and don't let it go. If you loved baking back home, find a way to bake here. If you loved something back home or want to try something new, find your community here, because there's 1,000 communities that sometimes it feels like it gets lost in translation, and you're looking for something that may exist but doesn't feel right. But if you keep looking, there's definitely something there. There's a way that you identify in the city always. So that's the one thing I love about New York, is you feel lost until you don't.
And you've given everyone a path to find a different version of themselves as well today. So Natalia, yoga teacher, student, graduating this year, MCAT. I can keep going. I know about the unlimited things you have done at this point. What's next for you?
Well, at this moment, I am studying for my MCAT and applying for jobs. So I will be going into the, healthcare fields. At this moment, I'm actually really looking into community programs, really wanting to either work with the same, Latin and Indigenous population, where I can learn and also gain different types of cultural perspectives. Yet also the type of medicine I want to go to and that I'm applying for is similar. It's underserved population track or the rural track. I just have such a deep commitment to that is what I love. I realize that when I wake up every day, when I'm working towards that, and it's not when I get there, it's just that is what's driving me through life. It feels like my life force of it's just something I'm meant to do and I'm going to do. And so no matter how long it takes or what path I need to take to get there, I will continually work to work alongside the rural, underserved, Indigenous, Latin, transborder, you name it, populations. So yeah, just hopefully medical school in the future, looking for jobs at this moment. And this semester, Linden has an exciting thing coming up where for the APE panel, I was telling you about the opportunities, how it didn't feel quite right. So we're actually, we decided to do a major event where we're working with the Black Public Health Network, and with them, we are going to discuss with different clubs, affinity groups, if they would like to join. And we're going to have students join this APE panel where there'll be people from organizations that are offering APEs and internships for those specialized communities, so that students can go in and ask about these opportunities and apply if they really want to. And so we're really trying to open the door for working with, perhaps it's the queer health collective, whether it's women and Black women in public health collective, or even the Southeast Asian public health collective. All of those, we want to people feel identified and have a home. So that's my last project of the semester, and then after that, it will be onto the real world.
How lovely. This interview is being shot in February of 2025. You might not have this event happening when the episode is live. However, you should always keep tracking what the other clubs are doing as well. And I'm sure Natalia has set up the entire system for the future for the club as well. So Natalia, this was a joy to talk to you. It's very inspirational to find someone that's so clear but tries a few things and chooses a path every time. And I think your public health journey is truly going to serve the world going forward.
Oh, that means a lot, Aman. Thank you for having me and for, just having this podcast. It is making a difference for students.
Thank you. Folks, that was Natalia De La Viña. We'll have all the stuff in the description. If you liked it and have something to share, put a comment down below. If you'd love to share this with someone that might be interested as well, please share it. And we'll see you in the next episode. Take care.